What if I told you one medication has probably prevented millions of heart attacks and strokes, yet it's also one of the most misunderstood medications in the world? Some people refuse to take statins because they heard they destroy your muscles. Others believe they cause memory loss. Some think they're dangerous for your liver. And many patients stop taking them after reading a frightening post online. So, who's right? As a pharmacist, this is one of the most common conversations I have with patients. Today we're separating myths from facts. We'll cover who should take statins, who probably shouldn't, the real side effects, why doctors prescribe them so often, and one thing almost every patient wishes they had known before starting one. Stay until the end, because I'll also explain why many people think statins aren't working, when they're actually working exactly as intended. I'm a licensed pharmacist, and on this channel I explain medications the same way I would if you were standing at my pharmacy counter. No hype, no fear. Just practical evidence-based information that helps you understand your medications with confidence. Let's get started. Let's start with the basics. Statins are a group of medications that lower LDL cholesterol, the cholesterol most commonly associated with plaque buildup inside arteries. You might recognize different statin names, as these are some of the most popular today. Although they're different medications, they all work in a very similar way. Here's something many people don't realize. Statins don't just lower a number on your cholesterol test, their real purpose is reducing the risk of heart attacks, strokes, and other cardiovascular events. That's why your doctor usually isn't treating your cholesterol. They're treating your future risk, and that's a very important difference. Imagine the inside of your arteries like the plumbing inside your home. When those pipes are clean, blood flows easily. Oxygen reaches your heart. Your brain gets the blood it needs. Everything works normally. But over many years, LDL cholesterol can enter the artery wall. Your immune system reacts. Inflammation develops. Gradually, plaque begins forming. Most people don't notice anything happening. There isn't any pain. There usually aren't any warning signs. That plaque may slowly grow for years, or even decades. Then one day, it can rupture. A blood clot forms. Blood flow suddenly stops. That's how many heart attacks and strokes happen. Here's the important part. By lowering LDL cholesterol, statins help reduce the chance of plaque progressing and help stabilize existing plaque, making it less likely to rupture. That's one reason statins have become one of the most widely prescribed medication classes in modern medicine. This is probably the biggest question patients ask. Do I actually need one? The answer depends on much more than your cholesterol level. Today's treatment decisions consider your overall cardiovascular risk. Statins are commonly recommended for people who have already had a heart attack, a stroke, certain types of blocked arteries, or established cardiovascular disease. They're also commonly recommended for many adults with diabetes, because diabetes significantly increases long-term cardiovascular risk. Some people may benefit because of very high LDL cholesterol levels. Others may benefit because several moderate risk factors combine to create a higher overall risk. Your healthcare provider may look at things like your age, blood pressure, smoking history, diabetes, family history, kidney disease, and your estimated risk of developing cardiovascular disease over the next several years. That's why two people with exactly the same cholesterol level may receive completely different recommendations. Medicine has become much more personalized than simply chasing one laboratory number. Here's where things get fascinating. Most people assume cholesterol comes only from the foods they eat. But your liver actually makes a large amount of the cholesterol circulating in your bloodstream. Think of your liver like a factory. Inside that factory is an important enzyme called HMG-CoA reductase. Its job is helping manufacture cholesterol. Statins partially block that enzyme. When cholesterol production slows down, your liver responds by pulling more LDL cholesterol out of the bloodstream. That's why LDL levels begin to fall. And over time, lower LDL levels are associated with a lower risk of heart attacks, strokes, and other cardiovascular events in appropriately selected patients. What's remarkable is that this process happens quietly. You don't usually feel your cholesterol dropping. You don't wake up one morning feeling different. which is exactly why many people mistakenly think statins aren't doing anything. But preventing a heart attack isn't something you can feel. Sometimes the greatest benefit of a medication is the event that never happens. Now that we understand why statins are prescribed and how they work, let's answer the questions everyone really wants to know. Do statins actually cause muscle pain? What about memory loss? Can they damage your liver? Should you take CoQ10? Can you ever stop taking a statin? And what's the biggest mistake pharmacists see patients make after starting one? Let's dive into the evidence. Let's start with the concern I hear more than any other. Statins made my muscles hurt. Here's the honest answer. Yes, statins can cause muscle-related side effects in some people, but the story is much more complicated than many headlines make it seem. Muscle aches are one of the most commonly reported reasons people stop taking statins. However, muscle pain is also extremely common in adults for many other reasons: aging, exercise, arthritis, other medications, and everyday wear and tear. That makes it surprisingly difficult to know whether the statin is actually responsible. The important takeaway is this: never ignore severe muscle pain, profound weakness, or dark-colored urine. Although extremely rare, those symptoms require prompt medical attention. For people with mild muscle symptoms, don't assume you have to quit your medication forever. Your healthcare provider may recommend trying a different statin, lowering the dose, taking the medication less frequently, or evaluating for another cause of the symptoms. Many patients who don't tolerate one statin do very well on another, and that's something many people never realize. Another myth I hear almost every week is, statins are bad for your liver. Here's what we know. Statins are processed by the liver, so it's reasonable to ask that question. Small increases in liver enzymes can occur, but serious liver injury from statins is uncommon. That's why your healthcare provider may check liver function before starting therapy and evaluate further if symptoms suggest liver problems. If you notice symptoms like yellowing of the skin or eyes, unusually dark urine, severe fatigue, or persistent abdominal pain, contact your healthcare provider promptly. For most people, the benefits of reducing cardiovascular risk greatly outweigh the relatively uncommon risk of significant liver problems. Another topic that gets a lot of attention online is memory. Some patients report forgetfulness after starting statins. Researchers have studied this question extensively. The overall evidence has not shown that statins routinely cause memory loss in most people. If someone notices new cognitive symptoms after starting any medication, it's worth discussing with their healthcare provider because many different medical conditions and medications can affect memory. The key message is this: don't stop your statin on your own because of something you read online. Talk with your healthcare team first. Here's one that surprises many patients. Some studies have shown statins can slightly increase the likelihood of developing diabetes in certain people who are already at higher risk. That sounds alarming, until you look at the bigger picture. For people who have a moderate or high risk of heart attack or stroke, the reduction in cardiovascular events generally far outweighs this small increase in diabetes risk. This is a perfect example of why medication decisions should always be individualized. Every medication has benefits. Every medication has risks. The goal is finding the balance that's right for you. Many patients ask me about coenzyme Q10. Can it prevent muscle pain? The evidence is mixed. Some people feel it helps. Other studies haven't shown a consistent benefit. At this point, there isn't strong evidence to recommend CoQ10 for everyone taking a statin. If you're considering adding any supplement, discuss it with your healthcare provider or pharmacist to make sure it's appropriate and won't interact with your medications. Here's the mistake I see most often as a pharmacist. A patient starts feeling better. Their cholesterol numbers improve, so they decide, I don't need this anymore. But that's like saying, my smoke detector hasn't gone off, so I don't need batteries. Your cholesterol improved because the medication was doing its job. Stopping a statin without talking to your healthcare provider may allow LDL cholesterol to rise again, increasing long-term cardiovascular risk. If you're having side effects, don't disappear. Start a conversation. There are often options: different statins, different doses, different treatment plans. That's what your healthcare team is there for. So here's my advice as a pharmacist. Statins are neither miracle drugs, nor are they the dangerous medications they're sometimes portrayed to be online. They're evidence-based tools that have helped reduce heart attacks and strokes for millions of people around the world. They're not right for everyone, but they're absolutely the right choice for many patients. The decision shouldn't be based on fear, or social media, or a single headline. It should be based on an informed conversation with your healthcare provider about your personal risk, your goals, and your overall health. Remember, treating cholesterol isn't really about cholesterol. It's about protecting your heart, protecting your brain, and helping you stay healthier for years to come. Are you currently taking a statin? Have you experienced side effects, or has it worked well for you? I'd love to hear your experience in the comments below. If this video helped you better understand statins, consider subscribing to Medications Explained by a Pharmacist. I try to post every week to break down medications in clear, evidence-based language without the confusing medical jargon. As always, this video is for educational purposes only and is not medical advice. Never start, stop, or change a medication without first discussing it with your physician, pharmacist, or other qualified healthcare professional. Thanks for watching, and I'll see you in the next video.